Over 80% of the population will experience an episode of lower back pain at some time during their life. Lower back pain is the second most common cause of disability in US adults and a common reason for lost work days. If this is you, keep watching, because in this video, I'll tell you about the 10 things that you need to stop doing now that could be making your lower back pain worse. Hey guys, this is Dr. Bassem Mankirius with Cornerstone Physical Therapy. In order for lower back pain treatment to be most effective, we have to make sure that we stop doing the things that are causing more harm in the first place. In other words, stop doing the bad before doing the good. So here are 10 things that you need to stop doing in no particular order. Number 1, bed rest. Being on prolonged bed rest and not using your muscles will lead to atrophy and loss of strength at around 12% per week. After 3 to 5 weeks, you will lose about half the normal muscle strength. This will make it much harder in recovery because it takes much longer to build the strength back up. And this will increase the chances to re-injury due to the weakness. The second thing is doing setups. Doing full-on setups puts a lot of unnecessary stress on your lower back and could cause re-injury. Third, getting up from bed improperly. Similar to the setups, this will lead to increased stress on your already injured lower back. Fourth, prolonged sitting or standing. It's a good idea to change your position often. When you're stuck in one position for a long time, your muscles start to shut off and you lose the support of your lower back, which causes instability and in return starts to cause pain. Changing your position more often keeps your muscles from going to sleep. 5. Heavy lifting or poor lifting techniques. Even if you have a good technique during lifting, I would skip lifting heavy objects while you have lower back pain because it increases the risk of injury. If you absolutely have to lift something heavy, make sure to practice good lifting techniques by standing as close to the object as possible with feet spread apart. Bend at the hips and knees, making sure that your knees don't go forward past your big toe. Brace at the core and maintain your back in a neutral position. Grab the object and lift through your lower extremities, keeping the object close to you and maintain a neutral spine. Another thing to avoid is bending and twisting. Repetitive bending causes increased pressure in the front portion of the disc, which increases the chances of disc herniation. Repetitive twisting can cause overstretching or tearing of the muscles or supporting ligaments around your spine. 7th, smoking. We all know smoking is a serious health risk, and smokers are also more likely to experience back pain than non-smokers. One reason for this is that nicotine restricts blood flow to the discs in the spine. This can cause them to dry out, crack, or rupture. Smoking also reduces the amount of oxygen in the blood, which causes a reduction in nourishment to the muscles and tendons in the back. An unhealthy weak back is more vulnerable to accidental strains and pulls that cause back pain. 8th, jogging or prolonged walking. Both will increase the pressure going through your spine, and if you have nerve compression, they will only make it worse. 9th, straight leg raises. Because of long lever arm created by the straight leg raise, it demands a lot of stabilization from the core. And if not stabilized properly, you could cause more stress in the lumbar spine. 10th, stomach sleeping. When you sleep on your stomach naturally, you will start to sink in the mattress and cause your back to overarch, which will put more stress on the joints and nerves in your lower back. So there you go guys, these are 10 things to avoid doing to have better recovery from your lower back pain. If you have difficulty sleeping, click on this video where I show you the best sleeping positions for your lower back. If you liked this video and thought it was helpful, please subscribe and hit the like button. If you have any questions, leave them in the comment section below. Thank you for watching.